So good afternoon, everyone. Today we're going to be talking a bit about HIV and AIDS, as yesterday was World AIDS Day. And we're lucky enough to have a guest speaker with us, Ali, who's from the Terrence Higgins Trust.
Hello.
And then, so there'll be time for a Q&A after the talk. So if you use the Q&A function at the bottom of Zoom, we'll get the questions appeared there. And then just a heads up, I don't need to do that anymore because we're not live streaming, but this is being recorded. So, but only the panelists are being recorded. So, so over to you, Ali.
Thank you very much, and thank you very much for inviting me. So, as Darragh said, it was World AIDS Day yesterday, and I work for the Terrence Higgins Trust. And what I'm going to do is I'm going to share a presentation with you that I've put together, especially that kind of explains a little bit about what AIDS Day is about, but also why, why we talk about HIV and AIDS and what the difference is and what it means and why we've got red ribbons and everything like that. So obviously the Terrence Higgins Trust, we are the leading UK sexual health charity. We are sex positive and we make no judgments or assumptions. It's just a wonderful place to work for, so I really enjoy that. I've got a couple of links down here that you can go to with our website and our Instagram, and also an email for anybody who is interested in doing some more training sessions or anything else like that to do with Terrence Higgins Trust in Suffolk. So at the moment, we actually offer the C-card scheme, which involves free condoms and chlamydia screening for 13 to 24-year-olds. And you can find out where to get those at the Young and Free website. We do professionals training around sexual health, and we actually come into the university to work with some students around sexual health and things like that as well. We do relationship and sexual health sessions in hostels, clubs, places of education. And we also do HIV testing, which is confidential testing, exactly the same as chlamydia, with support as well. Now, obviously with the changes within lockdown and then tier systems and everything, it's always best to go to the kind of websites or email us at Sexual Health Suffolk if you want to know more about when we are specifically open. Failing that, it will be on the door, and there'll be a phone number on there as well. So going to do a quick guide to HIV today as well, how it's transmitted, reducing the risk and prevention techniques, knowing what to do and where to go if you need to test, and how we can stop HIV in our lifetime. Yeah, and that means my lifetime, because obviously I'm older, so I've got a shorter lifetime left. So how to stop HIV in my lifetime, okay? And I've got a link here at the top to the THT website, particularly to do with taking action on World AIDS Day. So our aim this World AIDS Day and throughout December, and the rest of the year as well, we support people living with HIV in the UK who are struggling through the turbulence and isolation caused by the global pandemic. So that's what we're focusing on this year. But together we can help people living with HIV to lead happy, healthy lives, smash the HIV stigma, make the future free from HIV transmission. This is the brilliant thing. Reduce isolation and loneliness and create a better future for everyone affected by HIV. So World AIDS Day, it's always on the 1st of December, no matter what day it is. Obviously it was yesterday, we were still in lockdown, we couldn't do a lot at all, there's been a lot of online things, and this evening those of us in Suffolk, well, some of us in Suffolk are doing a workout for World AIDS Day, and so we're heading along to a field this evening where I should be filming, and the rest of my team are being involved in doing lots of workout sessions and things like that. I'm a dancer, not an exercise person. But on the 1st of December, we traditionally remember those who are no longer with us due to HIV. And there's been Zoom celebrations and kind of vigils and things like that going on throughout the organisation. But we raise money to support those living with HIV. We raise awareness around HIV to stop stigma. And you can be part of that too. So if you wear your red ribbon as support, normally we'd be going back, thank you, Darragh. Normally we'd be going around with boxes asking people to donate money, but obviously we haven't been able to do that this year. But you can actually go onto the website. If you go onto tht.org.uk, you can donate and get your red ribbon sent to you. You can donate to Terrence Higgins Trust no matter when. So if you go to the website, you'll find out how to donate, and you can help us raise awareness through your knowledge and challenging the stigma associated with HIV. A lot of people of my generation still think that people with HIV have got a death sentence and they're going to die early. This is not the case any longer. But we need to understand how it's transmitted. So first of all, HIV stands for Human Immunodeficiency Virus. Basically, it's a virus that attacks the immune system. So the immune system, as you know, is the thing in your body that fights against colds and infections. So HIV attacks that, which means that if you haven't got your immune system working, all the infections and other diseases you get are going to severely affect your body. AIDS stands for Acquired Immune Deficiency Syndrome. Now, this is a collection of all the illnesses and things that happen to you when you are living with late stage HIV. You catch HIV, you don't catch AIDS. AIDS is something that develops much later on and is the name for the collection of illnesses that you get because your immune system is deficient. So now we don't use AIDS unless it's World AIDS Day in this country. We use the term late stage HIV because we're fortunate enough to have medication where very few people are dying from late stage HIV. So AIDS is an outdated and stigmatizing term, but we still use it for World AIDS Day because it's used around the world. So your immune system is your body's protection against disease, and HIV damages a part of the immune system called the CD4 cells. Now I appreciate I'm starting to get a little bit scientific here, and some of you may not be interested in that side, but I know some of you are. So that's why I'm going through it. So when you're first infected with HIV, the virus targets immune system cells called CD4 cells. Your body produces antibodies to try to fight the virus off. This process is actually called seroconversion, and in most people it happens within 45 days of infection. However, it can take anything from a few weeks to 3 months. You will also be infectious during this period, even though you may not be aware you have HIV. Without treatment, HIV will cause damage to your immune system, leading to infection and illness. And this will actually happen in 3 stages over a period of time. So you'll have HIV without infection symptoms to start off with, then HIV infection with symptoms, and then late stage HIV. And we're talking anything from 3 months to 30 years that this can happen over. And it's never the same for everybody. So everyone is different. So the aim of the treatment is to have a viral load, and this is the technical term for it, that is undetectable. So basically, a viral load tells you how much HIV there is in a drop of blood. Okay. The test results, when you do an HIV test, give you a good idea of whether the amount of HIV is high or low. And that will depend on when you got HIV into your system. However, the tests can't measure very small amounts. So when you have very little HIV, you'll be told it's undetectable. Okay, this means there wasn't enough in a sample of blood that the test could actually see. It doesn't mean that HIV has disappeared entirely. So once you get HIV, it never goes away. It will still be present in other parts of your body like the gut. But If your viral load is undetectable, so there's not enough HIV within a sample of blood for the test to see it, there is only a little bit of HIV in your body. And the aim of the HIV treatment is to have an undetectable viral load. And this means that your HIV is being kept under control. Now, I notice we've got a few questions here. So Darragh, if you want to have a look at the questions, and if I need to answer them straight away, please let me know. Otherwise, I'm going to power on, if that's okay.
So none of the questions have come through for me. So, but when I get them through, I'll let you know.
Oh, right. Let me just have a quick look then and see what we have got in the chat. Oh, here we go. Oh, it's all to do with technical issues. We're now live on Facebook. Yeah, this is brilliant. Right. Okay. So I don't need to answer any questions yet. That's great. So you can get HIV through unprotected sex. That's sex without using a condom or a dam or a barrier between you. Okay, barrier between the sexual fluids. You can get HIV as a baby when you are inside your mother's womb, so during pregnancy or through childbirth. And you can get HIV through injecting drugs when you share a needle. That's it. In this country, you will not get HIV from any blood transfusions or operations with blood plasma products, because all blood and plasma is screened in this country for HIV. So the only way you're going to get HIV in this country is by sharing needles if you're injecting drugs as a baby, either during pregnancy or during the actual birth itself. However, all pregnant people in this country are offered full STI screenings, and if they're offered HIV tests, and if they're found to be positive with HIV, they can have treatment, and it won't allow the baby to contract HIV from the mother. Or you're going to get it by unprotected sex, by not using condoms and dental dams. So those are the ways you're going to get HIV in this country. HIV is not transmitted by insect bites, toilet seats, kissing, sharing cutlery, and I can't see the other one because there we go, I'm touching, there we go. My screen of people is right over the end there. So you're not going to get it on toilet seats because you're not having unprotected sex with the toilet seat. Okay, you're not going to get it from kissing because HIV doesn't live in the saliva. You can't get HIV from oral sex. At all. It doesn't matter if you spit or swallow, you will not catch HIV through oral sex. You won't get it by sharing cutlery or sharing razors, sharing toothbrushes, anything like that, because there's not enough blood to keep hold of the HIV. And once HIV is in the air, it dies. Okay, unlike corona, HIV dies in contact with the air. With insect bites, there's not enough blood there to pass on the HIV. So you're not going to get it. Oh, and the H stands for human. I hope that dispels some of the myths. There is no cure. Okay, there was a Berlin patient who had hematopoietic stem cell transplants. It's not feasible as a cure. It was far too painful for them. It was far too expensive. You know, that's not going to happen. There is no vaccination. Research is still ongoing, but there is no vaccination. However, there is medication. There is treatment. Treatment suppresses the virus to undetectable levels. This is why I needed to tell you about the viral load and how much HIV there is in the blood and all this kind of thing. because they did a whole big study called the partner study. It was the world's largest study of HIV positive people who'd had condomless sex, so sex without using a barrier, without using a condom, with their HIV negative partners. And they found no linked HIV transmissions after couples had sex 58,000 times. Obviously, that's not one couple having sex 58,000 times. That's 58,000 instances of sex without a condom. So the treatment suppresses the virus, so it can't pass it on. So you can get HIV through unprotected sex. You can get HIV by sharing needles. A mother can pass HIV to her baby, only through childbirth or in the womb. So there are other prevention techniques. So if you haven't already got HIV, there is PrEP, condoms and dams, and PEP. Now, I'm going to go through these very quickly, but if you want to know more, you can go to the website and check up on details. And I've also put a link in so you can find out where you can get these things too. So PrEP is a pre-exposure prophylaxis. It's basically before you have your wonderful time. And it's a course of HIV drugs taken before sex to reduce the chances of getting HIV. Now, when I say before sex, I don't mean immediately before. It's not like, oh, right, get the condoms out, get the PrEP out. No, it's something that you need to take well in advance. Okay, for some people, it might be a month in advance. For some people, it might be a week or a few days. And that depends on you and your sexual activity. That will be a discussion with the staff at the iCash clinic when you go to get your PrEP. So it has been shown to be highly effective in clinical trials such as the PROUD study. If you want to know more about the PROUD study, look it up. It's really interesting. So there used to be a problem getting PrEP in this country, but for now, we now have PrEP available on the NHS. This is brilliant, folks. And you can find the link under I Want PrEP Now. And for guidance and information about it, you can go to the NHS website too. So this is the medication you can take before you have condomless sex. Obviously, you can use condoms, whether they are internal condoms for vaginas, external condoms for penises, or dental dams for use over the genitals or anus for oral pleasure. The whole point is that these are creating a barrier between your sexual fluids and your partner's sexual fluids. Okay. The reason why I've put dental dams in there, even though you can't get HIV orally, you can get other STIs. So I've added them in to make sure people know about them. And they, when used correctly, they can prevent transmission of HIV and other STIs. If you want to know how to use a condom correctly, we have a video for how to use an external condom correctly on the Young and Free website. PEP is the post-exposure, so it's after the event. It's an intensive course of HIV medication given to a person that has been exposed to significant risk. So this is the after the time. The risk of exposure is assessed on an individual basis, which means they will need to ask you questions. They are only asking to make sure that you are still within the window period of PEP. They are only asking to make sure they can give you the actual risk percentage that's going to affect you. So do be honest when they ask you questions at the clinic. It's for your benefit. So if prescribed, start PEP as soon as possible, ideally within 24 hours. So it is something you need to go and get, similar to the morning after pill for unwanted pregnancies. You need to go and get PEP straight away. Within 24 hours, it reduces the risk of transmission by 80%, which is huge. It is actually a 28-day course of antiretroviral drugs. Blood tests and follow-up for 6 months will be required just to make sure whether it has worked or not. Obviously, if it's only 80%, then you need to make sure it has worked. Now, if you're regularly having condomless sex, you need to be regularly testing for HIV. That doesn't matter what kind of sex you are having. There are some sexual activities that are more at risk than others. And I'm not going to be gender biased here because it's not a gender thing at all. I'm talking about holes. So a vagina has a stronger wall than an anus. No matter what gender you are, if you are having sex with an anus, you are more at risk of contracting HIV from your partner if they are HIV positive. And that's simply because of tears that can happen in the anus. So it's not gender biased at all. If you are having condomless sex, you need to think about testing for HIV and knowing your status. And it shouldn't be a stigma anymore. There are different types of tests depending on when the possible transmission of HIV occurred. So I've listed them here. You've got a self-test and a postal test. You've got an antibody test and an antigen test. I didn't want to go into too much detail because we're really getting into the nitty-gritty now. But if you think you want to know more, if you think you may be at risk, get an appointment at the iCash clinic. Go on the iCash website, go on the Terrence Higgins Trust website, go on the NHS website. They will have more information there for you so that you can make a decision whether you think you need to test for HIV. But testing is the only way to know for sure. So you can test at sexual health clinics. So iCash, which is the nearest one to the University of Suffolk, is the Orwell Clinic on Limburg Road, and it is appointments only at the moment. Even in the tier 2, it will be appointments only. So you will need to go through the website or maybe ring up. There are only so many appointments available. It may be something that you need to plan in advance, and you need to be using condoms in the meantime. You can try community outreach settings. So testing at the THT office, which is on Orwell Place, actually in the town centre. You can actually email us at the moment for more information about when our clinic will be up and running, because obviously we're hoping to have it up and running again pretty soon outside of lockdown. You can test at home. You can get a test sent to you, and it doesn't come in a big box with HIV test written all over the front like your Amazon package does. No, it's very discreet. Okay, you can order one at the test.hiv site, through the THT site, or through the iCash site. So it's home sampling, home testing. You can get them sent to you. Now, you can also get other STI tests sent to you from the iCash website as well. So if you're interested in screening, not just for HIV, but for a lot of the other STIs, visit the iCash website. You can get those sent to you. Treatment as prevention is also another prevention technique. Okay, HIV medication is intended to suppress the virus to undetectable levels. While this doesn't mean a person has no longer got HIV, it does mean that they are much less infectious. And if they have an undetectable viral load, they cannot pass on the virus. Now, this is huge, because this means as someone living with HIV, if you're on effective medication, you can't pass it on. Undetectable is untransmittable. On the Terrence Higgins Trust, we talk about you to you as far as HIV is concerned, because undetectable viral load is untransmittable to any partner. So anyone with a viral load of less than 50 per drop of blood is classed as undetectable. They cannot pass the virus on even during unprotected sex. I know I keep repeating it, but I think it's worth repeating. So to reduce the risk and prevent transmission, take PrEP beforehand, condoms and DAMs during, PEP afterwards. You've got choices there. Test regularly and use treatment as prevention. So if you are HIV positive, if it is detectable in your system, use the medication. People on effective HIV treatment cannot pass it on. Now, testing is the only way to know for sure, like I said earlier. High risk would be lots of anal sex, lots of condomless sex with many different partners, sharing needles when using drugs, having lots of sex with people you don't know, only because of the risk factor. At the end of the day, it doesn't matter who you're having sex with. You are the only one who knows what your sexual history is and what your sexual health is. You may be in a committed relationship, but we all know that some people don't always tell the truth. It's always good to test. It's always good to make sure. So at the iCash clinic, the sexual health clinics, full STI testing, HIV care, emergency contraception, and again, I've lost my word, and psychosexual counselling, okay? You can get advice on treatment on all types of contraception, implant, IUS and IUD insertion and removal, EHC termination advice and referral, chlamydia screening for under 25s. So if you go to the iCash website on details how to make appointments. If you prefer to have a particular person at the iCash clinic look after you every single time you visit, for example, some people may find it beneficial to see the same person because that person knows their background history, then you can ask for that. Okay, you don't need to see a different person every time. So how do we stop HIV in my lifetime? So in the UK, HIV has changed from a fatal infection that's chronic to manageable lifelong condition due to advances in treatment. So through increased testing and early diagnosis, using treatment as prevention, condoms, PEP and PrEP all play a part in reducing the numbers of new infections. So if people are no longer transmitting HIV, we're not getting anybody who's new HIV diagnoses. We have lots of people at the moment who are living with HIV that are living into their 70s and 80s, and they're living long, healthy, happy lives on medication. They're having happy sex lives with their partners, knowing that they cannot pass it on to them. They are able to have families because they're not passing on HIV to their partners or to their children through pregnancy and childbirth. So the future is a lot brighter for someone who has HIV and who is living with HIV. And it's through awareness that we need to stop this stigma. Okay. So you can support us by wearing your red ribbon to show your support. You can donate, and you can help us raise awareness through your knowledge and challenging the stigma. Sorry, went too far. So these are the main websites that I signposted you to as well. Now, hopefully at some point, I'm going to get set up some times to actually go in and around the university. We normally used to camp outside Athena Hall with our little chlamydia kits and our condoms and everything like that. And hopefully we're going to be able to do that at least once before Christmas. And I'm going to let you know and make sure posters are up. So if you see anyone with these kind of tops on, the Terrence Higgins Trust, we've got our logo in the top right hand corner there. We will be offering you condoms if you're aged between 13 and 24, and we'll be offering you chlamydia screens, and we'll be able to signpost you to where you can get support around HIV as well, and let you know when we're doing our HIV clinics. So don't be offended if we ask you, do you want to do a test for chlamydia? Because that's what we get paid to do. We get paid to talk about sexual health, and we want to stop this stigma.
Awesome. Thank you so much for speaking with us. So I'm going to open the floor for questions. So if anyone has a question, they can either post it in the general chat or in the Q&A function, and we'll be able to respond. And we'll give it a few minutes to see if anyone submits any questions. Just quickly, we have a few students who are over 24, obviously. And I noticed that the iCash clinics only did chlamydia testing up to 25, I think it was, or 24.
So you can, the chlamydia kits that we send out through iCash, you've got 2 different age ranges. So when you go onto their website and you click through what kind of test you want, you need to make sure you put in your correct age in there. Don't try and nick the under 24 ones, go for the over 24 ones, if that makes sense. But there's only so many released every day, and you have to be really quick in the morning. And that's all to do with funding. So there's only enough funding to release 30 tests every day. And I think you have to get on at 6 o'clock in the morning to actually book it if you're 25 and over. The reason why the under 25s are so important is it's that age group that has the most cases of STIs in the country. So 1 in 10 sexually active young people aged between 15 and 25 have chlamydia, and they might not know it because not everybody gets symptoms. In fact, not many people get symptoms. So if you have a vagina, only 75% of you will not have symptoms. If you've got a penis, 50% of you won't have symptoms. And the symptoms are for things like chlamydia. It's like when it hurts when you pee, and you might get a discharge, and that's about it. But it can actually affect you quite a lot. So it can make you infertile if you don't get it treated. So it's important to test when you've got the opportunity. And they recommend testing with every change of partner and at least once a year if you're sexually active, even if you're with the same partner, just to make sure. And it's just, it's becoming with chlamydia almost the same as it is with HIV. Sometimes you don't know. Sometimes you just need to test to find out. So, yeah.
Thank you. Maura has submitted a comment which says that I think the important thing is letting students know that it isn't embarrassing. My friends used to get embarrassed when they were approached on campus, but it's important to stay safe.
But yeah, it is important to stay safe. Well put. And I think we have such a taboo in this country about sex. No, it's sex. We all like it. We all do it. This is why adults go on about it all the time. It's actually pleasurable. Okay. And that's why we have it. And, if you're not having sex to create a baby, then you're having it because of pleasure. Why not talk about it? I mean, you don't need to share your intimate things with people, but we should be talking about sex, the benefits of sex, the pleasure of sex, the things against your sexual health and how to look after your sexual health. So yeah, when we do approach you, we're not asking you, are you dirty? Because it's not dirty people who get STIs. It's people who don't have knowledge that get STIs. you can get an STI the first time you have sex, even if, you know, you've done any kind of sexual act, you can get an STI. So, you know, let's move on. Let's look after our sexual health like we look after our dental health or our physical health or our mental health, because it affects all of them.
So Charlie has asked a question which says, can I quickly mention the stigma towards asexual people, because I'm never really sure what to say when approached on campus.
So if you are asexual, you don't need to give us that you are asexual. A lot of people just say, oh no, I'm okay, thank you. You know, and although we're about raising awareness of sexual health, you will have friends who are not asexual. You having knowledge about sexual health means that you can support your friends. At some point in your life, you might have children, you might have nieces and nephews, you might have grandchildren who you want to support by talking to them about their sexual health. So knowledge is a good thing. However, I completely understand if you're not having sex, then you don't need condoms or to do a chlamydia test. And you can just say, oh no, thank you, I'm fine. And, you know, we might turn around and say, but did you know? And say, actually, yeah, I did, because I spoke to you earlier. And I know that lots of people do have chlamydia, but I'm okay, thank you. That's fine. We don't get offended by people turning us away. We just want to make sure we're there if you need us.
So Maro asked a question this time and was asked, so how can students get free condoms and etc. right now in the COVID situation?
So right now, if you go to the Young and Free website, if I go back, I'll get it up. Actually, I'll put it in the chat. Let's put it in the chat. I'll put it in the chat. You go to the Young and Free website and you can go online. I'm just going to type. I can't multitask on Zoom, I'm sorry.
That's all right.
youngandfree.org.uk. And you can actually order condoms by post at the moment. Now, obviously, it's not going to happen immediately because we're not Amazon. There's no prime on this. It doesn't happen straight away. So it does take sometimes up to a week to get them. So do bear that in mind. And do make sure you put a correct address in there, etc., and things like that. So, but you can get them by post at the moment. We've been doing condoms by post all through the pandemic. It was quite amusing in that in April, I think we had 44 applications for condoms by post. And by May, it was 444. So, you know, we know people having sex. You know, you may be isolated with somebody you're having sex with, so you'd still need condoms. So as a student union, you can be C-card trained. So you can actually train to be a C-card provider. And we have C-card training sessions. If you go to the Eventbrite website, where they have the training sessions on, I'm just going to type that in. C-card training. So for those of you who are running organisations or anything like that, if you know about safeguarding, then you'll be able to be trained as a C-card provider. If you don't know about safeguarding, we'll have a discussion about that as well. And if you're doing a course, for example, where you're going to be working with young people, so if you're going to be a social worker or nurse or anything like that, then C-card training is a great thing to do. All of our professional training is free. And at the moment, we're doing it online too. So you do the C-card training, which means you can actually give out C-cards and condoms and chlamydia tests. to people at the university if you did the training. And it's something that you can take with you after the university as well. Once you're not working for the SU anymore, you can still be a C-card provider in kind of wherever you are working if it's to do with young people. Oh, also, if you can check if you've still got the Young and Free posters up around campus. I haven't got any here at the moment, but it will say youngandfree.org.uk. If you haven't, send me an email and I shall bring some in, or get some posted to you or dropped off to you. And there is a QR code on there that goes to the website and everything like that.
So I think that was all the questions. I can't see any on Facebook. So thank you so much for speaking with us. It's been really informative and I've learned a lot. So it's been really useful.
I was going to say our official, because normally our testing week would be the week before or running up to the 1st of December for HIV. And we'd normally go around to places in the community and offer HIV testing because of course it's free. And we haven't been able to do that this year. So Terrence Higgins Trust actually changed National HIV Testing Week to the 1st week in February. So from the 1st to the 7th of February, 2021, hopefully you will, well, providing we're not in another lockdown, we are hoping to offer HIV testing. It is confidential. Okay, nobody else needs to know what your result is. So if you want to test with us, we'll be doing something in February in the 1st week, if you haven't already tested by then. But like I said before, you can get the home test kits and do it yourself. And then obviously THT offer support as well.
Awesome. Sorry, I'm just making a note of that so I remember.
Yay.
So Jess has asked, do you need to be showing symptoms to get HIV tested?
No. So basically what will happen during your HIV test is if you think you need an HIV test, you will have basically a short consultation beforehand, where it is a whole load of questions. It does sometimes feel like an inquisition because we do need to talk about your sex life. So you will be asked quite intimate questions. We do not judge. We do not judge on what has happened, what you have done. That's not why we're asking the questions. We're asking the questions to find out if you were at risk and whether it's a high risk, low risk, or medium risk. And we will tell you within that consultation. And then you still get a choice of whether you want to do the HIV test or not. So the HIV test that we do is a finger prick test. So it'll actually be a finger prick, the blood is sucked up a little tube and then put in the little vials, and you will get a reaction to that test within a short space of time. And depending on which test it is, will depend on how long it takes. Some take 60 seconds, some take minutes, but we'll let you know that when you book your appointment and when you come in and we talk to you about it. So it's at that point that you know what's going to happen. Okay, so we talk through why you think you're at risk. We talk through what we're going to do during the test, and then we talk to you after the test as well, because whether you're positive or negative, it doesn't matter. What matters is that you thought at that time you needed an HIV test. And there are emotions and thought processes that go through with that as well. So you get the full consultation. Now, obviously, we have to use PPE at the moment and everything like that. So depending on what is set up now will depend on whether you do the test yourself with one of us sat there with you, or whether we do the test for you. as in we suck up the blood into the little vial and everything, or you might need to do that yourself, but we'll be there to coach you all the way through it, because we know that sometimes that support is needed. Did I answer that question? I kind of went off on one.
I think you did. Also, that was really good information, because I know that a lot of people are like, I don't know what's going to happen, and that can be like really scary.
Yeah, it can be. I mean, it's for anyone who has had a moment of where somebody in their relationship could be pregnant, it is that life-changing moment when you suddenly think, actually, I might be at risk of HIV. You know, it's not going to kill you anymore, but it is a life-changing moment emotionally and physically. Because if you are detectable, if you are positive for HIV, it does mean that you have to take medication. It does mean that you will have to have regular testing. It does mean that you will have to think about looking after yourself more. It doesn't mean that you have to tell everyone. You are not legally obliged to tell anybody. But the people who do your test with you will talk through that in more detail.
Maro, just wanted to double check, how frequently should you get tested?
That's a good question, and it all depends on the risk factors. So that would be something you would need to kind of have a discussion about, depending on how risky your lifestyle was. We would normally recommend kind of every 3 months, every 6 months, every year, but that all depends on the risk factors. So if you go to the Terrence Higgins Trust website and find out more information about that, then you can do it based on your experiences.
Just give it a moment to see if anyone else has any like final questions.
Oh, I knew there was one thing I needed to mention as well that I didn't put in the slide, I forgot. So if you are a trans person, HIV treatment medication does not affect any of the hormone medication or anything else that you'll be taking for your transitioning.
That's really good to know. Because I know that, yeah, that's always the worry, is will this interact with anything else that I'll be on?
It is, yeah, and that's basically, they found out that it doesn't, I mean, people with HIV, living with HIV, are not at more risk of catching COVID either, you know, so that's really good to know, because obviously it was something we were all kind of a bit anxious about to start off with, but no. If you're living with HIV, you are not at more risk for catching COVID. It's other illnesses and long-term illnesses that you're more affected by COVID. But there is, you know, a lot of information out there, and I could be here all day, but you don't always need to know that, and it depends on a person's experience and a person's lifestyle as to what the answers would be. There is not one size fits all as far as it is, you know, HIV is concerned, but the medication is brilliant. You know, it's just one tablet every day for the rest of your life, and you can't pass it on.
That's amazing. The fact that it's especially because it was so underfunded for so long.
It was.
The fact that they've managed to develop a way that it can make you completely undetected with the limited amount of funding they have is brilliant.
Yeah, and it used to be that we couldn't get PrEP in this country either, and it was only people who were on a particular trial that could get it in certain areas, but now everyone can get PrEP if they have a need for it, which is really important, because it was only targeted at certain communities, but now you know, if you need PrEP, then you can get PrEP. So if you go to the NHS website, you can find out how.
Awesome. I think we could probably wrap it up now. So thank you so much for joining us and for giving us such an amazing and informative PowerPoint and presentation.
Yeah, it's a pleasure. So hopefully we'll be able to do it in person. Oh, right. Well, I was going to say it is 3 o'clock. So thank you very much for inviting me. And I hope to see some of you on campus at some point. Please feel free to say hello. It's always nice to put faces to people as well. And, you know, you are aware and help us raise awareness and challenge stigma. That's the best thing.
Awesome. Thank you so much.